Have you noticed your vision getting cloudy or lights seemingly too bright lately? These might be more than just signs of aging. They could be early cataract symptoms. If you've ever wondered what cataracts are and how they silently impact your daily life, you are in the right place. Welcome to today's video. I'm Dr. Ayesha Butt. Thanks for tuning into our channel. In this video, we're breaking down the most common cataract symptoms and signs, from blurry vision to trouble driving at night, and showing how they can gradually change the way you see the world. Whether you're experiencing these issues yourself or looking out for a loved one, understanding what cataracts are and how they affect everyday life is essential. Let's dive in. What are cataracts and how do they develop? Cataracts happen when the clear lens inside your eye becomes cloudy. This usually happens gradually over time. It can affect one or both of your eyes. Let's go over a few early warning signs. Blurry or foggy vision, sensitivity to bright light and glare, trouble driving at night, colors looking faded or yellow, needing stronger glasses more often. Many people assume this is just part of getting older, but these are signs your eye is trying to tell you something. That's where I come in. As your optometrist, I help catch these early signs before they begin to impact your quality of life. So let's talk about what causes cataracts and who's at risk. The most common cause of cataract is aging, but it's not the only one. Here are some causes and risk factors. Too much sun exposure without UV protection. Diabetes, especially if the blood sugars are way out of control. Long-term use of steroids, including common nasal sprays. Oral steroids can also increase the risk of cataracts. Smoking, eye injuries, radiation treatments, inflammation inside the eye. There are other types too. Some of the cataracts are formed in children, and call it congenital cataracts, which are present at birth. Traumatic cataracts from injury, and secondary cataracts linked to other health conditions such as diabetes. Cataracts are progressive in nature. If left untreated, they can cause permanent vision loss. That's why regular eye exams matter, even before you feel the symptoms. So what is my role as your optometrist? While I don't perform cataract surgery myself, I play a critical role in your cataract care, from early detection to preparing you for surgery, to managing your recovery afterwards. So let's talk about what I do before the surgery. We call it preoperative care. First, I listen. We talk about your vision goals and lifestyle. Do you want to read without glasses? Drive comfortably at night? Maybe see clearly for distance? This helps us choose the right IOL or intraocular lens. Based on your goals and your budget, next I check for any eye surface issues like dry eyes, blepharitis, or eyelid problems. We want your eye in the best condition possible before surgery. Then I coordinate with your other doctors. If you have glaucoma, retinal disease, diabetes, or even history of stroke, I make sure we get proper clearance first. This avoids surprises after the surgery and helps set the right expectations. Let's talk about after the cataract surgery or post-operative care. On day one after surgery, I check your healing process. This is just as important as the surgery itself. We go over your eye drops, make sure you're using them correctly, and understand why they matter. These drops prevent infection, reduce inflammation, and protect the eye while it heals. I also check for pressure spikes in the eye and make sure your retina isn't swelling or it's at risk for detachment, which is rare, but sometimes I always watch for. Around week 4 to 6, we fine-tune your new prescription if needed and make sure your other eye is on track if it also needs surgery. So let's recap and summarize. Cataracts are common, but they don't have to disrupt your life. Early detection is key. Your optometrist, me, is your first line of defense. I help catch cataracts early, guide you through decision-making process, and work closely with your surgeon to make sure you heal safely. So what's next? If you've noticed vision changes or just haven't had a thorough eye exam in a while, now is the time. Like this video and subscribe for more on how to keep your eyes healthy. And if you have any questions about cataracts, drop them in the comments or book an appointment. Thanks for watching.